Good morning, good afternoon, good evening, my fellow YouTubers. Welcome to another edition of Living Simply and Fun. I'm your host, Aries, and that's Aaron.
I didn't know that. Am I really Aaron?
No, you're not. Your name is Toilet Bowl.
Oh, okay. Sounds great. Nice to meet you. I'm Toilet Bowl. Let me guess, you're Latrine.
Nope. I'm not Latrine. I'm not Listerine. My name is Aries.
I never said Listerine. Listerine and latrine aren't quite the same thing. Can you imagine latrine scented or latrine flavored Listerine? Oh, that'd be horrible.
Well, today's going to be a different topic. It's somewhat transgendered, somewhat not. We did get some information from two fronts. Let me just say, first of all, yes, we got some information for the Center of Medicare Services regarding dental, eye, and etc., including transgendered services, and it's kind of more complicated than we imagined.
Yes, in fact, starting with the transgendered thing, apparently to get it done, you have to first be on Medicare. Second of all, you need to get your Medicare gender marker changed so that you end up being classified as the gender in which you are seeking to be. You have to have your name legally changed and all that. You have to have doctor's referrals according to the proper standards from all the proper sources. Then you have to be able to submit that to a doctor who is already dealing with Medicare, who can give you a proper referral to a doctor who accepts Medicare. Unfortunately, none of the doctors are currently accepting Medicare from what we can gather.
None.
We've only gotten one reply back so far on that. But the office says that the few cases that they have attempted to submit to this point, because Medicare does not issue pre-approval, has not been approved because they're saying it wasn't medically necessary, and the doctors don't want to work 8 hours to not be paid because Medicare won't cover anything. So they won't take it, at least not yet. And the problem is that they ended up submitting things that weren't done in the proper fashion. Had it been done properly, Medicare would have taken it first, but since they don't take Medicare now, and they've cut out Medicare from these doctors, then it's impossible because you can't get a referral to a doctor that actually takes Medicare.
However,
I wanted to finish what was said in that thing. What was said is there might be a few doctors who are not recognized or known, who are new startup doctors, who might take it, but they might end up doing a botch job so horrible it can't be corrected. But this is what you'll get for your money with Medicare, if you are lucky. Because they might do it and take the risk that they won't be paid.
Also, by the Center for Medicare Services said that Medicare procedures can be performed and billed. But when it comes to the managed care plans, the Medicare Advantage plans, you need prior approval to go out of state for a network provider. Most doctors will not take those insurances.
And the Advantage plan usually works from an outside source other than Medicare, along with Medicare, so the outside source also has to approve it. That's something that's not mentioned there. So let's say that you have Advantage plan and MetLife is the one that's handling the extra care, and MetLife says absolutely not, we don't recognize it, we won't do it. Then Medicare won't say, well, we can cover the rest of it. So, even if you have an Advantage plan, doesn't necessarily mean that you will get it.
The only insurance company, it's stated, from all accounts, is the one that's through the city of San Francisco that pays for it. That's the only one I heard a doctor taking. Every other doctor refuses to do the surgery because of it. Also, it says medically necessary. Again, the Center for Medicare Services.
And what they deem medically necessary, well, that's going to be real hard to prove that it's medically necessary and you'll die without it. Chronic depression and suicidal thoughts is not medically necessary to have it done.
No.
The feeling of, I can't work like this, I can't even leave my house like this, that's not going to work because, for one, if you don't leave your house and you don't go out, you're not technically following the standards of care to even get your surgery because you have to live 2 years full-time in public.
I want to say that the letter and the emails I got from doctors basically said they're trying to work with Medicare, but they want full price. They don't want half price or quarter price.
This is what we got, is that what ends up happening is Medicare basically says, oh, I'm sorry, you want $70,000 for the surgery? We deem that surgery is only worth $8,000. We're going to pay you $7,000, and then you're going to only be able to charge the patient, we say, $150. But then Medicare ends up saying, well, we're not covering any of it, but because you submitted it to us, you can only bill the patient $150. So they get paid $150 for the surgery. They're screwed. That's why the doctors won't do it.
Exactly, and that's the thing. The letters that we got basically said one doctor out of them all did the surgery for like $200,000 and apparently submitted to Medicare saying, okay, I can do more. Medicare turned around.
Speaking of which, it was apparently a female to male given the figure because phalloplasties are far more expensive.
Exactly, phalloplasty. So, surgery's done. They submit the bill to Medicare. Medicare turns around. Sorry about that. Medicare turns around and basically slaps them in the face by saying you didn't go through the proper channel. And so far, from what I understand, they don't want to do any more surgery, so every other doctor is waiting to see the outcome.
Dental and mental apparently work the same way. There's absolutely no pre-approval, but at the same time, you have to get pre-approval. Since there's no legitimate way to technically get pre-approval, because you can't actually contact any human being that works for Medicare, unless you call them on the phone, which you usually get like an 18 or 19-year-old high school student trying to pay their way through college or save up for a summer vacation or a winter whatever. Just an average worker doesn't really know anything about the Medicare principles and patterns and everything. They're just a call center.
Yeah, exactly.
They basically say, hi, how are you? What can we do for you today? Oh, okay, we'll make a notation in here for you. And, that's about all they'll do. They might try to explain your bill. They can pull up, because you don't exactly get a bill, but they'll try to explain.
Your bill comes every 3 months.
What I mean is they'll try to explain based on their computer things about your account. I said bill, I meant account. I'm trying to rush things a bit. I'm getting in trouble all the time with using the wrong word when I'm attempting to rush something. So, anyways, it seems that all this was a smokescreen for the government to basically say, look, we're not discriminatory, stop suing us.
Yeah,
and now
exactly.
you can't sue them because they don't offer it. It's just they don't technically cover it.
Exactly, and that is why I wanted to say, when I talked to Medicare directly, and Aaron knows this recently, I asked them several questions. One was, even though it might be lifted in 2014, the 2015 handbook still says it's an elective cosmetic surgery procedure, which is not covered by Medicare. That's the other thing that they said.
Yes,
they also said here that they do individual basis of determining, but how do you determine is what the doctors are saying.
This is how the 17 and 18-year-olds work on the phone. In fact, this happened to Rita because she's trying to follow the proper procedures because, heck, if it's offered, why not take advantage of it? At least it's better than living your whole life unable to afford it, and, well, it's there. It doesn't mean that it's necessarily right to be there. But she decided to try to change her gender marker, so she sat on the phone for like 2 hours waiting for Medicare. She finally gets some pimply-faced little kid who basically says, hi, thank you for calling Medicare. How can I help you today? and it's like, oh, I'd like to change my Medicare gender marker from male to female because I need to do it and explain the exact reason why. And they sit there and they're like, we're very sorry, sir, but we don't do that. You'll have to call Social Security because I can't find anything that says that we do that. Very sorry, sir. Have a nice day. Sir, wait, hold on. I just told you my name's Rita, and I'm male to female, and I want to change my gender marker. You're now discriminating against me by refusing to recognize me by the gender in which I just asked you to refer to me.
My apartment manager is the same way like today. It was him, and she, and I wanted to...
Oh, I didn't want to get into that.
But you get the point. I just hate discrimination.
Then Rita spent 2 hours getting a hold of Social Security, and the person on the other line is like, hello, how can I help you? Again, it seemed to be a snot-nosed little punk kid who was working their first job in a call center. And Rita says, I was told to call here by Medicare, and I'd like to change my gender marker. Oh, I'm sorry, please contact your local Social Security office, click. I mean, literally, the phone call was like 5 seconds before they hung up. Like they were in a hurry to get out the door because they wanted to get home and watch their favorite TV show, or they wanted to go hang out with their friends and, go to a movie or something.
Well, yeah, exactly. So
they had no interest whatsoever in actually handling the phone call. So you know what? If you're trying to get your marker changed, you're going to have a hard time of it because we don't know how the office is going to react when Rita goes in on the 3rd to try to get it changed, but we're going to try to
The
go
5th.
January 3rd or 5th. We're going to try to go January 5th to get it changed. And we'll see how that happens then. I have a feeling they will not do it. It's my hunch, and I'm taking a wager on it. I give it no better than a 10-to-1 chance that they do it. Or whatever.
It says
I'm not
here.
very good at
It
betting
says
odds.
here that if I bring a copy of my name change court ordered, that it says change legally from male to female, they'll take that. They already have a copy, anyways. And then it says here, if whatever state you're with, the only way they could do it is if your ID is already female. If your ID is not female, they can't change it.
And DMVs will never change it for you unless you can trick them into doing it.
That's
It's about the only way, and it's technically an illegal manner to do it.
Yes, and, well, I'm not saying anything there.
We already know that from the DMV, because the DMV won't change it unless your birth certificate's changed. Birth certificate won't change it in many states unless your Social Security and Medicare have changed it, but Social Security and Medicare won't change it unless your ID's changed. So how do you technically get it changed when each place refers you to change it somewhere else first? And, well, you can't very well. The easiest probably is actually getting the DMV to do it.
But most DMVs don't, and the ones that do are states like California that turn around and they say, we don't discriminate. Here, have a female. And then you go to Washington, it's like, well, you want female, you're going to have to give me your certificate saying you've gotten your dong cut off and you got a taco. That's what the fat schlub said in the office.
And by the way, don't forget that if you happen to have female gender marker on your identification and you happen to do something of a legal nature in which you have to show your ID, you may very well be discriminated against for that. Rita had somebody actually sitting there trying to file off the F because they thought it was wrong. There's been a situation where she actually was talking to an officer who saw her ID, and they thought it was a fake ID because of the F on there. I'm sorry. So you happen to get things done properly, and now all of a sudden you start getting people who get their panties in a knot.
Yeah, it's called pure discrimination because of it, you know.
And of course, then they say they're not discriminating; they just don't understand it.
Yeah. Yeah, exactly. I even said that to the manager. My ID says female. What do you want me to show you?
Well, at least our manager's not rude and crude.
Yeah, well, that one lady was kind of, irritating. Or, no, not that. That one guy. The guy was like, I'm not showing you it, but the guy basically was sitting here. Here it is, by
He
the
just
way.
did it because he wanted to get you out.
No, he wanted to basically do it. It's right there, scratch. He even took a key.
Oh, you
right
mean
there.
him.
Yeah, that one guy, that's my ID, and it says, right there. As long as I don't...
Doing it without showing anything other than your sex, weight, height, and eyes. I don't think there's anything else on here that's... But...
Can't.
There, you can see it. Gender F right under my finger.
Yeah.
She actually got hers changed.
Yeah.
She's proud of that.
Yeah,
But
and then I get
that has caused her trouble because she's got it that way.
Yeah. Exactly, and then, you got these dillholes that basically are always discriminating because of it. And they're like, oh, it's not real, it's not real, it's not real. Yeah, it is.
See, what Rita ended up
Incoming message.
sort of doing, sorry about that, she basically told them that the old place she lived, the DMV out there, did put that on there even though it was wrong because they thought she was a horribly ugly woman and they assumed that she was a man. And the guy said they had no right to put that on there. And she said, well, I kept trying to get them to fix it. They never would. And so essentially the guy said, you know what, I'm just going to change it for you. You're new here, new ID. We're actually a friendly place. We'll make it right. So, sorry about their discrimination out there. And he went ahead and changed it. Unfortunately, that probably wasn't exactly right, but it worked. And it's since then, now she's got the female gender marker on her ID. Something very difficult to have done. And now Social Security is going to have to change her Medicare card. Once her Medicare card's changed, then she can get her birth certificate changed by a state that actually says they only do it if you have a proper identification card and Medicare card or Social Security card that state that you're female. Or male if you happen to be female.
Well, even
male.
if you submit a thingy, the state of Ohio doesn't change the gender marker.
And Ohio can still deny it. even then, because they can use the fact that it's their own state law not to.
Exactly.
Even though, honestly, there's a back door that they kind of have to. You got to get somebody who actually understands that. And, of course, most of the people who operate their phones and run their offices don't have a clue.
However, the thing about the gender markers, if you have an ID that says female, apparently, and you have your name change and your female thing on your driver's license or ID card, then what it said is you can get your passport and your new gender too, because State Department can't discriminate. But that's beside the point.
Yeah, so anyways, I can't think of anything further to say on this.
The Center for Medicare Services, like I said, explained to us in detail, a doctor did too, but they also said that most, and he forgot to mention this, most doctors or dentists basically don't accept Medicare for certain reasons. He got the answer today too.
Yeah, because they can't bill you beforehand, and they have to bill you afterwards, but then Medicare won't cover it, and then they can't do anything.
So anyways, because of this whole Medicare thing, and they claim in the one paper I was reading how you got to be pre-authorized. As the doctors have said, how do you pre-authorize something? They can't. It was a smoke screen.
Yep, and so most doctors won't take it because they know that there's no pre-authorization and that they're just going to get screwed out of money by Social Security.
So they're not taking
and or by Medicare, and then Medicare is going to turn around and tell them that even though they don't get paid, they also can't charge the patient more than a certain dollar amount. And then they have to do it afterwards and hope to be paid for the little amount that they're allowed to bill. And that's, speaking of which, we found out for a fact after reading several things now that our hospital is doing illegal activities because if Medicare tells them we won't cover this, they charge the entire amount to the Medicare recipient.
Yeah, I mean, I got a bill
they are
recently.
not allowed to bill, period, more than 20% covered or uncovered.
$900 the other day I showed him for blood work. He says, what the fudge?
Because Medicare wouldn't cover the blood work, they charge the full $900 for the blood work, which they're overcharging on the blood work, and they're not allowed to charge more than 20% of what Medicare deems necessary. So since Medicare says that the blood work's essentially $200, they can't charge them more than $20 for it. But our hospital, in an attempt to recoup their losses because they're in the red by almost $4 million, they're basically attempting to screw Medicare patients, which isn't doing them any good because they either end up having to write it off in the long run or end up turning it over to a collection agency where they don't get nearly enough for it. So I don't really understand why they do this practice.
Look at this one thing.
It hurts them more in the long run.
Like Medicare says that we only get charged 20% for mental health counseling, right? I had to pay $40. That's what, $160?
I had to pay $40 too. And the thing is, I qualified for a sliding scale of $0 according to their official policies at the place. And yet they decided to charge me $40. Which means, by the way, that if we both had to pay the base, that probably means that you qualified on the sliding scale for something too. They probably had to charge you only like 15 or 20. They probably screwed you too.
Well, the guy got canned because of threats and stuff, but point is, the hospital has been doing this left and right, basically, and then
they want the people to end up paying more in taxes so that they can get a levy. I'm sorry, it's just not right. They're attempting to steal from the people even further after stealing from the people to begin with.
Don't forget, Aaron had to be very polite. One day I was frustrated. I said, "What am I going to do?" And Aaron says, "Don't worry, hon." Gets on the phone. Found out the lady we're supposed to talk to wasn't answering phones that day. They were so damn understaffed that she says, "Oh, what is it?" Answered all questions. "Oh, okay, well, they sent me a bill. I got 2 days to pay a bill. I just got a bill."
Yeah, they said it was going to collections if it wasn't paid within 2 days and that there would be serious financial complications and possible lawsuit in small claims court if it wasn't paid within 2 days. I'm sorry, that's a lot of threats to be making to a person in the first place. Also giving a person 2 days to pay a bill when they've been paying their bill according to an agreement with the hospital, and they hadn't even received a bill yet that they could have made a payment on, and then trying to threaten them, that is illegal practices.
And she goes in, and this is the email I got from her sweetheart, by the way. You know her. Yeah. I'm not giving her first name or something in case she finds this video. But she turns around, looks on the bill, and says, You paid one bill in full, 46. What? They want to bleed blood from a turnip? I said I just paid a mental health bill that just costed me another $40, and she's like, "Don't worry about it. You just pay this much next month."
I mean, I was talking to yesterday about OIC. They think that I can afford $247.
Yeah, if you give up all your cigars for 2 months. 4
I only
months.
spend like $40 on cigars.
6
at
months
most.
then. See, 6 months.
So
it'd
take quite a few months. So speaking of the fact I can't afford anything, there's my shoe. Hole in it. Middle of winter. We don't have snow on the ground, thank God, but it's been raining for the last 5 days. Hole in the shoe. And yes, I know it stinks. That's because water gets in my shoe and then it starts festering in there. Sorry, it's what I got. I got a pair of shoes with a hole in it.
I got a pair of shoes that I got to replace, but Walmart, every time I go there, don't have my shoes, so I got to hope like hell that I can sit there, roll up a newspaper, being funny, and say, "Bad dog," if we even have the neighbors sitting there putting around in their car, and end up going to the liquor store. I need to go to the damn shoe store.
Yeah, I need to go to the shoe store too, and unfortunately Christmas did a doozy on us. I ended up having to pay the shipping for sending out to 4 people, including 2 of her family members. Had I not had to pay the shipping, I probably could have gotten myself some shoes. And I had Christmas presents to buy. I can't tell people, "I'm sorry, I can't get you a present. I know you probably got me something, but I can't get you anything due to the fact that I have no shoes."
That's use wrong. My finger hut credit.
If somebody gives you something, you have to give them something back. It's just a matter of,
Well, let me
honor.
just share you with what I got him for Christmas for all of you. And Cindy, 1981, if you're watching this, don't take this badly. I had 5 boxes from the U.S. Postal Service. He told me to fill them up. So every day for 5 days, I was taking a dump in it and then sealing it up and being like, "Here, wrapping." He's like, "Okay."
I don't even know why that.
I just thought it'd be funny, But no, he's got some decent gifts. I just hope he likes them, I just thought I'd throw that in there because he says we're goofy and humorous, but
we are goofy and humorous, or at least we try to be, and it's a bizarre humor.
Exactly. But, like the time I had a bizarre humor and almost got ripped a new one at the hospital for making a joke. We won't go into the joke. Aaron knows what it was.
It was a joke that was an inside joke between you and your mother. Your mother understood it and knew you weren't serious about it, but instead the hospital wanted to throw you out and thought you were a horrible daughter to your mother. They even made comments to you about it and how they didn't even like to see you at that point. And it's like, you know what? Understand an inside joke sometimes.
Go watch the movie,
may sound wrong to you,
The Shootist, is what I told him. Mom even said that. Go watch the movie The Shootist. He says
actually, there's no harm in telling the joke. Your mother used to basically joke, "When I die, you'll probably come dance on my grave." And there she is in the hospital not feeling well, and she's like, "Throw me to the wolves, please." And Rita basically answered with the old joke, "Well, then I'll have to come dance on your grave." And of course she was overheard saying that. And so the hospital thought, what a horrible daughter to be sitting there and her mother's sick in the hospital and telling her mother, "I'm going to dance on your grave." It wasn't said out of anger. It was an inside joke.
Yeah, pretty much.
And it was one started by your mother.
And the problem is Mom doesn't have a grave already. She's been thrown to the dump.
Yeah, essentially she got thrown to the dump rather than to the wolves. But
yeah, because of the whole urn thing,
And it had nothing to do with us. It ended up in the hands of one of her sisters who ended up having some boyfriend troubles, ended up leaving her boyfriend, including the mom's ashes, back in the state in which he was living, and then he threw out everything she owned. So therefore, Mom got thrown out with the stuff that she owned, that she left behind. So Mom had her ashes go into the garbage somewhere in South Carolina, or was it North Carolina? North Carolina. So Mom is currently in a garbage dump in North Carolina somewhere. Of course, the sister says it's all untrue and Mom's safe and sound, and that she ended up spreading her ashes out across a mountain like she asked.
Illegal.
It's illegal unless you actually get permission, and you have to get permission by going through certain processes in which you have to sign some things. You still have to pay a fee to do it anyways. If you happen to get caught, you can actually go to jail for up to 10 years and be fined as much as $500,000.
Oh, look at exactly. So, anyways, enough about that. Medicare basically got back to me. Same with Social Security. So instead of sitting there, for all you video viewers out there watching this video, me and him's got to figure out the topic. The real reason is this is what I've heard from certain things, and I will answer this. I think he wants to get out of it. Hold on.
The topic's essentially an update to Medicare and sex changes.
Okay, so the bottom line is what has happened is the ACLU supposedly and several legal teams went to go after HHS, the Health and Human Services that handle Medicare and Medicaid. They decided we're just going to lift it saying we're not discriminatory a-holes. Instead, they knew damn good and well that even if you did, the billing part would be denied anyways, through and through. And then I've heard from several people saying, well, transgendered, what was it? It was going to be here. Someone was telling me this too by HHS. A doctor wrote me on this one. It said, right here, routine preventive care for all eligible persons. When it said that, it was talking by the letter that the doctor was basically stating that means like re-augmentation of breast implants every 10 years. Well, because of it, as Aaron just left, because of it, they don't even have to cover that. It's under the plastic surgery clause in the handbook. So basically what they did was they said, watch the left hand while we do something on the right. We lifted the ban, said it can be medically necessary. But most doctors, unless they fully accept Medicare and is one of these low-life doctors that just got their degree to perform breast implants and sex changes and don't know what they're doing, then the professional doctors that have done it for so long is not going to be doing it, because from all the letters that we've gathered from HHS and other sources, and the letters are trickling in, that the doctors do not want to touch it because they want contracts, from what I understand, with Medicare, saying that they will get paid in full. So if you have $500,000 with the surgery, the doctor will want to do maybe, say, 10 of them a year, and then they got their retirement set for a year. Or, 25 a year. Or let's just say they want to do it. Let's just say there's 1 million transgendered people that are disabled on disability. They might just want to earmark 20 years or 30 years to help them all, but that could increase 500,000 people in that time frame and slot period. So therefore, if you look at the statistics, what they're trying to do is make a contract where they'll say, well, we'll give them plastic surgery, we'll give them breast implants, we'll give them GRS, we'll give them hormones, we'll give them therapy, we'll give them everything. But in return, we want a huge chunk of money between, say, $100,000 and $500,000, and that's what they're shooting for, even $750,000, locking in for facial feminization. So what they're trying to do is doctors are trying to work together, but other doctors, from what I understand, the non-transgendered doctors that aren't transgendered apparently aren't basically basing on helping the transgendered patients. They already know how Medicare works because they're waiting to see what happens with other doctors. Nowadays, doctors are doing the surgeries. I've read a couple reports where doctors did a surgery or two, submitted the bill to Medicare, and Medicare says, whoa, we're not paying it. We don't know if it's because of the gender marker or it's because of some other reason. We don't know, but the report is they're still fighting and they're trying to get in touch with Medicare to see if they can get a contract. Apparently, Medicare is very difficult to contact, from what I understand. So, that's what I gotta say on that. Like I said,
I was in a bit of a pain, so I couldn't sit here anymore.
Yes, I'm well aware of it. That's why I took over. So anyways, I think that covers that. Now, the medically necessary thing, we're going to see what happens if and when he has to have half his face removed because of an infection in his jaw, if they're going to allow it, or if they're going to let him get killed because of it.
What?
The abscess.
When they remove that. You're looking at me like...
When they remove half his jaw,
horribly wrong with me?
You're like...
Besides the fact I'm in a lot of pain.
Then you should go and relax. So anyways, the point is there you have it. He's got an infection. It's really killing him. Yeah, they say everything's got to be medically necessary, but if you look at dentists...
And it's $2,000 I can't afford.
$2,000 times 4. Remember, it's like 4 teeth.
Yeah, it's only the one that I need to get done now.
Well, anyways, $2,000. Unless he wants to give up smoking cigars for 2 years, the other options I've heard is he should move out of state and go to another state that has a Medicaid program. But how many Medicaid programs will take and remove something like that,
you know? Medicaid program, what it is trying to find a place where there's a little more... what do you call it, competition, so the prices will be lower.
Yeah, well, in Cleveland the competition was lower,
No,
but
it
we
was
still had the credit
$750.
program.
Yeah, $750, but I could have afforded that in less time.
I was gonna finance it for him, but you know, the doctor basically said it was his name on the car, on the credit thing, or on the repair bill, so he should be the one on the credit. So, anyways, everyone, this has gone 30 minutes, as Aaron would say. The bottom line is, this is your sex change update. We've looked into it. We've gotten things started. I am a little more poor for you transgendered people watching this, because I've used a lot of my own postage stamps to get the answers needed, because I had a feeling, truthfully, that they lifted the ban to tell this army person to shut their pie hole and then not sue us. But then they said, watch the left hand while the right did something. And then, even if they've had their surgery, Medicare is probably not going to pay it because it's not medically necessary. All the reports from CMS, the Center for Medicare and Medicaid Services, or CMMS, basically say, you know, that they got to approve it in, you know, Medicare Advantage plans have to pre-authorize it out-of-state networks. And from what I understand from the doctors that got back to me that provide plastic surgery and GRS, basically said that 99.5% of the insurance companies will not cover sex changes. So even if it is covered, Medicare is lifting it, trying to get sex changes covered by the actual insurance companies. The ACA, the Affordable Care Act, had denied anyways. We don't even know what's in there, you know. But the point is, when it comes to sex changes, they knew what they were doing, but they also knew that it would just make everything happy. The doctors I've spoke to via telephone, you know, Skype, basically said everyone's happy. But when I explained my situation on how I do videos, that's why we got 50 plus views on the transgendered video on sex changes being paid by Medicare Part 3. Most of the people basically were very happy. The doctors that watched it were very happy and said yes. All the points were made. Most transsexuals want it done. They want to get on disability. They want to get on Medicare. But it's 2-year wait, and between then and then, they said it could take 10 years for them to iron out everything just to do it. But most doctors want to pay full price. I mean, look at what he said about the hospital bill. He said they can bill the hospital. If you're having FFS, breast augmentation, a GRS, they can take 21 days out of your hospital thing for Medicare out already, and the anesthesiologist. But that still to me leaves that Medicare. That still leaves that even if your insurance covers those two parts, you still got to take care of your breast implant surgery, which could be $10,000. He said, and GRS could be $40,000. That's $50,000. Now, if you're having FFS, that could be $150,000. So put the package together, it's $200,000. You might save $50,000 for hospital and for anesthesiologists because they can bill separately. They can't just sit there and bill. And by the way, I did find out for genetic patients, they will buy mastectomy, bra, apparently, and breast forms, but they will not buy breast augmentation or implants for cancer patients. And if it is, then it's medically necessary. Most of the time they say it's not medically necessary because, again, you're still alive after having your breasts removed. So it's a catch-22 of what damned if you do, damned if you don't. A lot of these transgendered patients that are on Medicare don't realize what's happening. So they basically say, oh, I'm going to get Medicare now and I'm going to have my sex change and it's paid for at the government's expense. Oh, yeah, I'm great. But then you sit there and for example, as Aaron and I were talking about, doctors have said that their email, the letters I got, and I send a lot of snail mail out. I like utilizing my post office box. And let me just tell you, a lot of doctors have said flat out right that their email box is so plugged that it's going to take a while for them. Now, if it's a question about Medicare, they do it as they can. But if it's actually something inquiring about pricing or availability or appointments and stuff, it's fine. But the main problem is the doctors have said, is so many people, there's like 1.5 million people on disability and retirement You know, and one doctor basically said, you know, if someone can live like 79 years old without having sex change and all of a sudden wants to get it done because they can, there's a problem. You've had enough money saved up over the years. Just get your dang sex change done. And why have the taxpayers pay for it, you know? So that's why a lot of these, that's another reason why the government decided, well, what is medically necessary? Medically necessary is something that, you know, for living, not for something where someone says, oh, I'm not going to go out anymore. I can't live. I need my sex change. Well, like I said in one video, those people should just go and find a hole or a cave and die in. But I didn't mean it literally. I was just being very angry at the time because, you know, I'm disabled, Aaron's disabled, but we don't have the depression where we think someone should just go and die because of it. I mean, if you got severe depression and you claim you're transsexual, maybe you need to have your head examined in a mental hospital for 6 months. Because then maybe you can actually realize that it's not depression. You just don't want to get off your butt and work because you think the government owes you something. And the government decided, okay, well, if these people want to sue us for discrimination, we're just going to do this, lift it. And then Medicare turns around and sends me a letter saying that you have to be pre-authorized if you have a Medicare Advantage plan. However, from the letter I got, I believe the government basically doesn't know how to authorize the sex change because the letters I got from an email from doctors from universities and some no-name doctors that do the sex change procedures, they have said, quote unquote, that do the surgery, then submit Medicare bill. But they don't want to do it because they know Medicare won't pay for it. So even if you submit, and by the way, there's another thing as Aaron forgot to mention, and this is the Medicare code for sex change. There is none from what we understand. How can you do a sex change if you don't have a surgical code for it? They have a surgical code for gynecomastia, but they don't have a surgical thing for breast augmentation, plastic surgery, or genital reconstructive surgery for phalloplasty or vaginoplasty. So you get the point. So I could sit here and rant and rave all day, but I want to get to my Quran, and I got to answer an email before it gets too late. So you get the point. The point is the Center for Medicare and Medicaid Services lifted it, but they ain't doing jack with it because it's on the need-to-know basis. And by Center for Medicare and Medicaid said it's on individual medical necessary, you know. But the problem with it is, how is it going to do it? Oh, it also says, and the doctors here that I've talked to say even if Medicare basically is being taken for their surgical procedures like the sex change, the breast augmentation, and facial feminization, and say hair removal, they want a decent price for it. Otherwise, they're not taking Medicare. That's why a lot of doctors won't, you know. And the thing is what the government, what this couple groups are doing, from what I understand from some advocacy groups that are fighting for transgendered people, is they want the sex change to be lower, like Thailand prices, so a person can pay less money, but then the doctors get screwed over, and then the doctors that can charge more will charge more for the ones that are actually paying it. So for one, the doctors, want to do only surgeries where they're getting paid full price for their 8 hours of work under a magnifying glass trying to reconstruct someone's genitalia, or even 10 hours, 12 hours for phalloplasty, where the doctors, say they want their money, and, they're entitled to it. They shouldn't be getting paid. Even if they were charged $70,000, Medicare basically turns around and says $70,000. We're going to only pay $13,000, and then it says you may be billed this much, but then they say to the billing department of the clinic you can only charge this much. So let's just say your bill is $800 for gender reassignment surgery. Yet someone complains, "Oh, that person got it for $800 out of their own pocket." But the doctor had to eat up the cost. Then what's the doctor do? She or he raises the rates through the roof so it can cover everyone else's sex changes that are subsidized, is what they call it, And then people complain about it, Let's see. Right here, it says here that through certain groups, the coverage decisions of trans-related surgeries will be made individual on the basis of medical need and applicable standards of care. Problem is, Medicare doesn't have an applicable standards of care. That's the thing. They released the thing saying and let it go out in all the world, but they can't discriminate. So what are they doing? You call up Medicare. They don't know anything. They say, "Oh, a sex change is cosmetic surgery." Call Social Security on your birth marker or, gender marker. You call Social Security. Yeah, well, you have to have the full sex change before we could do it. This was the last time I talked to them. The previous time before this. The last time they basically told me, "Come into the office, click." It was like 15-second call, and I was on hold for 2 hours. So the bottom line is, if you look at the transgender community, and you look over everything, you're going to understand that the transsexuality, it's not easy. Yeah, I mean, I've been transitioned since 1999, and look around. It's almost 20 years, and I'm still going through the hurdles, but I don't give up hope. Thing is again, medically necessary. That's the other thing. Medicare says they have to be. It's got to be medically necessary, and then Medicare's got to approve it. They won't approve it. That's the thing. They don't want to approve anything. Apparently, they say they want to help, but they don't want to help, because if they do want to help, they would start putting together codes for GRS. But as this says here, doctors that will take Medicare will grow. No, doctors won't take Medicare because they always get shafted on. I mean, look at my primary doctor. She charges almost $400 an appointment. I'm still getting paid $60 to $70 per appointment just to see her. So and then when I did the math the last time, Aaron got pissed off with me because we sat down and figured it out, and then he basically wanted to frickin' vent about it when he found out that Medicare. I was just looking at what he's doing, by the way. He's zoned out, but I'm not talking negative about Aaron, but Aaron did get angry when he found out that my doctor got charged 16% for Medicare and I had to pay the rest, and then he said it's unfair. So looking over all this evidence and information that I got now, it's what they've done is they've given equality to the transgender community without giving it. By basically saying, look at the left hand while we do something with the right, or watch the right while we do something on the left. And that's what they're doing to control the transgendered population by saying that they're going to cover sex changes, and they won't. So, for all of you out there, this is just basically what I have. Please look for more video follow-ups and updates as more information trickles in on our channel from various doctors, from emails, snail mail, and phone calls, so we can actually get to the bottom of this whole issue, because this is kind of an issue of today, It's not just about transsexual surgeries. As Aaron and I were trying to put it, it's about more than that. The elderly can't get hearing aids, they can't get dentures, they can't get glasses, they can't get dental work done if they have an abscess. Some people like me are lucky. You get an abscess, you go into the clinic, they pop the tooth out in 10 minutes or less, whereas Aaron's sitting there. And as I said in one of my previous videos when I was venting about, trying to explain to Cindy 1981 and Cigar Addict, they'll sit there and they'll take the middle tooth and they'll keep using those pliers, vice grips, whatever you call it, pulling it out. While they're pulling it out here at the local clinic, they'll break the back tooth and the front tooth just to get the middle tooth out for Aaron. And then Aaron's got 2 teeth that's damaged. And then they're like, ow, wow, and then you go back later saying, oh, well, you pulled this one out. Can you do that one? Out, you need a hospital setting. Then they throw them out, I go in there and Aaron's watching me and he times it. Numbs me up, wait 20 minutes. Then comes back and says, you're ready. And all of a sudden, done. Oh, you'll feel some pressure. All I'm sitting there is like, thinking God's good to me. Next thing you know, it's out. And then I'm asking one question, is that, let me see what the tooth looks like after it's been corroded. They show it to me. I say, may I take it home just for a reminder to brush more? Can't do it anymore. In the little disposal part for bio waste, that's it. And then we got people saying, that the sex change is medically necessary. Well, I'm sorry. It's like the doctors that talk to me on the phone. If a sex change person is going to start having a sex change at 79 years old, just like that army person at 74 or 75, then they've lived that long, then it's not medically necessary. Well, so what the government did was lifted it so this person didn't sue, and then said it's not medically necessary on the grounds that they've lived this long for it. Thing is, it's not going to kill you, and even if it does kill you, let's just say there's 1.9 million transsexuals out there, disabled on Social Security, for example. All of a sudden, the government turns around and says, well, it's not medically necessary. Let's just say 900,000 commit suicide because Medicare won't cover it. The government might sit there and say, oh, well, it is medically necessary. We just lost 900,000. Or government might turn around, sit on their butt for another while, trying to debate whether they should give it because, let's just say 900,000 transsexuals committed suicide. Next thing you know, they hear on the report 1.4 million transsexuals committed suicide. Let's just say 1.4 million from 1.9, that's 500,000 transsexuals left. Government might just sit there and say, well, we don't know. Next thing you know, let's just say there's only 50,000 on Medicare because every one of them committed suicide to make a point. Government might finally just say, well, let's just keep it this way and let them commit suicide to make a point. Eventually, some doctor's going to step in after, say, 20 years of this happening off and on, and they're going to say it's medically necessary. Look how many of them are trapped in the wrong body and they've committed suicide. Government's going to turn around and say, well, look at it. Who cares? Because they're dying for, whatever reason. If a 79-year-old person can live as a man for 79 years, then what the hell? A woman who's trapped in the wrong body could be a woman, And the thing is these douchebag people out there, not talking about transgendered and generic or doctors, but the doctors have claimed that if you can live this long, then, quote unquote, it's not medically necessary. I mean, look at the transgendered people that have Medicare already. And they turn around and say, oh, well, I need a breast augmentation because I have to get mine redone and I want like triple D's now and 800 cc's. The doctor says, okay. Does all the info and says, oh, I don't take Medicare because Medicare will only pay me $500 for your breast augmentation and $500 for your implants. I'm getting $1,000 out of a $12,000 surgery. Sorry, can't do it. And then they go, well, the government said they do it for, what do you call it? Preventive care. And they say it's preventive care to keep their womanly looks. Or I need a facelift and the amount of work done now. I'm a little older. I need my boobs bigger. They go in, doctor says the same thing. I'm sorry. I mean, have you seen any doctors out there? And I've looked in like many places since we've gotten this report coming in today because me and Aaron, we were very angry with each other. And I did a lot of extensive research last night. Then letters and emails trickled in today. And we're trying to make up with each other. But as Aaron knows, the whole thing is the doctors are right. How many doctors out there take Medicare? I mean, you look around, you got Medicare patients and heart specialists that say, oh, well, we have to make a special accommodation for you. Like Aaron, he went to the sleep study, and he said, I can't pay this, and this, so they made him sign a waiver saying that the doctor was only going to charge Medicare. That was it. He got lucky. Heart specialist was the same way, but they said, well, we're still going to bill you and you're going to make payment. Well, he made his payments off, but then they submitted him another bill from the clinic after he paid the heart specialist. Even though he didn't get the scene because he canceled because of a meth addict neighbor, he turned around and he got billed for that. He paid them even though he grumped about it. But he also got one for a mammogram thinking it might be breast cancer for his big, large breasts, And then they found out it wasn't, so they said, here, go here, bruh. Really? Mm-hmm. Right. So when it comes to Medicare, when it comes to the billing, they don't have the billing numbers for the sex change from what I understand. And secondly, they want a contract, and Medicare doesn't contract. The Medicare did say from their own report that if anyone takes Medicare, then other people will tell them to take Medicare too. Eventually, the doctor's going to be losing so much money that the doctor either has to raise his rates for everyone else, to offset the cost for the subsidized surgeries or not take Medicare at all. So private doctors, a lot of them are refusing Medicare nowadays because they're getting paid very, very little. And so they want to take regular insurance. Now, Medicare Advantage plans, for example, I got offered a Medicare Advantage plan, and I looked through all the Advantage plans on Medicare that I qualify for, between $50 and $80 a month. None of them cover transgendered surgeries. None of them. That's something that Aaron he forgot to mention. None of them takes transgendered care. So when you see a doctor that says, we'll file with your insurance company, yeah, they're trying to work. Doctors are trying. I mean, the letter I got via email today stated that they don't take insurance at all. Every doctor I've talked to via phone or via email says that most of them, that, they can apply for insurance, but insurance mostly don't cover breast augmentation unless it's a reconstructive surgery for cancer, and that's very, very rare. So what Medicare has done is basically shut the transgender community up by saying we're not discriminating, but at the same time we're only going to do so much. And the way they did it was to do it by basically saying watch one hand and we'll do another, and then basically people are sitting there. And I mean, doctors have been flooded since May or June, when the thing was lifted, basically stating that sex changes would be covered. They said, oh, I need my breast augmentation. Oh, I need my vagina. Oh, I need my penis. Then, one doctor basically decided, well, here's the proof that Medicare is paying for it. Submitted the information. Medicare says, whoa, we're doing it on an individual basis. You didn't do this. You're billing us for like $200,000. We want, and so they're, and this has been through like a 120-day appeal or something, denied still. So the bottom line is, unless doctors can work with Medicare, which Medicare is very hard to get a hold of, Medicare, Medicare might or might not pay it. It just depends. I mean, heck, I have problems at my local hospital on certain billing issues, but they bill for everything. You go in for a doctor's appointment, they submit blood work, then they tell you need a CAT scan, then they submit MRI, then they submit chest x-ray, head x-rays, whatever, EKG, all these different things, and you don't get one giant bill. It's condensed into one. You get one that says CAT scan, MRI, this service, that service, this service, that service. You can have all the way to Z, it's like A, B, C, this service A, and this service B, and this is service C, C. All the way to service C. And then you sit there and say, what the fudge? What the hell's going on with the government? When government sends all this, and then you're saying, what the hell's wrong with the hospital when they have to individual bill for everything. So you get the point. And the same goes with pre-authorization of Medicaid. Or not Medicaid, Medicare. Medicare pre-authorization. How do you get a pre-authorization? The insurance company to help supplement does it. But if you have regular Medicare, they expect you to have the surgery first and then get it done. That's why a lot of doctors won't do surgeries anymore, because they're like, oh, well, and then even if Medicare could sit there, this is how the doctors work. If you were rushed into the emergency room, and you had a massive heart attack, and they say, we need to put stents in her heart, we need to clean it out now, they'll rush you into the ER, they'll do it, and Medicare will be like, oh, well, we're only paying this much. The doctor says, well, at least they're alive, it was medically necessary. Medicare realizes it. Then Medicare pays it. But if they rush in the ER, oh, this person had their dong cut off, they're going to just sit there and give you a tube to pee in. They're not going to say it's medically necessary for you to have a vagina, because they don't have a doctor on staff to give it. Or what if you're rushed in from breast implant ruptures? They'll take the breast implants out because it's medically necessary, but they're not going to give you new implants. They're going to be like, it's not medically necessary. So each thing is different. Under emergency basis, it's medically necessary, but a non-medical emergency is not medically necessary. So that's why doctors were saying, the whole thing about, well, if you live this long as a man, almost 3/3 your life or 3/4 your life, then what's the point of sitting there and getting Mr. Dong cut off now when you're 85 and be like, I want to be a woman with no teeth? I mean, come on. It's not medically necessary at that age. That's why then the army person says, "Oh, well, it's not about age. It's about how I feel." And how do we know it's not about age? The hospital might say that you couldn't handle the anesthesiologist, for example, but I'm not there to judge their health concerns. I'm just saying, from my reports, letters I got, emails I've got, phone calls I've gotten, that's, me and Aaron's been in a kind of grumpy mood lately too, but we've been in our own bad mood lately, but you get the idea. The bottom line is, if you look at the entire big picture, the update for sex changes and Medicare, it's because, as Aaron said in one of his videos, Medicare does not work. Well, it doesn't. Medicare is broken. Medicare, people think it works, but it doesn't work. So what they've done is, with the administration, the Pinocchio thing. We'll give you sex changes, and then they say it's on an individual basis. But how do you do the individual basis? I mean, it doesn't even say. You got to Google like 500 different sites just to figure out how to change your gender marker because of this whole transgender thing on Medicare. And when you do go in and you have all your documents put together, you might get crapped on anyways and be like, I'm sorry, we can't do it. Or they'll turn around and say, we'll do it, but then you got a female gender marker and you got everything else changed to female. Now what? You go to your doctor and they'll be like, well, we can't prescribe hormones for you because of this. Well, my doctor's already, discriminatory. So the bottom line is, you get the whole point for everyone watching this. Look for another sex change update video in probably 3, 4, 5, 10 days. Whenever I get more evidence from other doctors that will pull in or talk to me or call me or send me information, then we'll talk about what they said. But as the doctors have gotten back to me in the Center for Medicare and Medicaid Services, basically they said under the 2015 handbook, because they didn't update it on their website yet, sex changes aren't covered. Now, they might do it for medically necessary, but they have to put it in the handbook, medically necessary. Then people would turn around, as the Center for Medicare and Medicaid Services said, and then they got to figure out who's true and who isn't. And every transgender person's going to say, it's medically necessary, I can't work. And that's what doctors have told me too. And doctors just don't want the taxpayer money going for it, so most doctors will refuse the sex change unless they get paid full price. So there you have it. It's all about abuse and abuse. And I actually decided, between Aaron and you, Cigar Addict, if you watched this far, thank you for encouraging me to try to go through this avenue for bottom surgery and stuff. But I was more curious, and I will tell you a story. I was going to buy some cigars next month, and they give you a free box of cigars. Free box of cigars. When you make a purchase of 20 cigars, and that'd give me 30. And I thought, I might give Aaron the box because, he's been good to me and everything else. And so I told Aaron's like, we'll wait till after January. You don't have the postage stamps. So I went out, got the postage stamps. I sat down one night, and I wrote the letters. And then I told him, don't worry about it. He's like, like the dog not getting anything from Duck Hunt. When, in the old NES game, when the dog pops up, he's like, doo-doo-doo-doo, with the duck. Instead, he's like, like he was sad when I said, the letter's already written. Well, I wrote letters out, posted them, had a lot. My envelope box here is getting emptier. I must be getting less and less writing this year. I usually write like 20, 30. I used to go through box every like 2 months or something, writing people. But nowadays, it's just, So I used up a lot of envelopes. Instead of getting 40, they actually give you 10 now, 10 more for your dollar. This cost me $1.39, so, or a dollar, I don't remember. But anyways, get the point. So when it comes to the sex changes, unless it's fully medically necessary and it ain't killing you, they don't want to cover it. So basically, like I said, they lifted it for their own reason, so they don't say that they're discriminating against. So, which is good. Then it shows the government's not discriminating. Now, if they allow transgender people in the military, that'd be a different story. But we can go on and on and on. Please look for a future video and a future date talking about sex change, Medicare pays for sex change update part 2. So, please add and subscribe if you like. Please post comments, leave feedback, suggestions. Thank you, and may God bless the world.